Um, okay, coming to the anatomy, I'll just touch upon. You must have read anatomy very closely in your anatomy days and physiology. Just for the repetition sake or the completion sake, I would say CNS. CNS is central nervous system, which is brain and spinal cord. Brain in and spinal cord is called central nervous system, and remaining nerves, peripheral nerves, peripheral nervous system, central nervous system, peripheral nervous system, and you have autonomic nervous system. Now, the latest is, as we yesterday, Dr. Anand Kishore also was talking about the intestinal nervous system. What is that? Enteric nervous system. Enteric nervous system is the latest one. It was part of the, it was actually initially it was included in the autonomic nervous system, but enteric nervous system or intestinal nervous system is a new entity now. It has got a wonderful functions in so many plexus of nerves that are involved in the regulation of your gastrointestinal movement. That is, enteric nervous system is a new entity. So, central nervous system, peripheral nervous system, autonomic nervous system, and the enteric nervous system. That is the latest. The everything comes together is your nervous system of the body. So, brain stem, spinal cord, and all these. So, with all these things together, have a beautiful function, very exceptionally coordinated functions. So we perceive with all the support of all these parts that we are talking, ANS, CNS, we perceive and we react. We perceive and we react. Suppose I am asking, somebody is giving me a tea. I am saying thank you to him. I am holding the cup. I am drinking it. I am seeing it. I am smelling it. I am tasting it. I am swallowing it. I am feeling happy. I am thanking the one who is offering me the tea. This is all brain function. We perceive, we perform, we react to the external world, external environment, situation, or stimulus. That is the function of the. That is the function of the brain, right? So together, the brain processes the information and forms a response. So that is in nutshell. It processes the information and responds. Suppose somebody touches me like that without my knowledge, suddenly reflexively I look back. So these are all the brain functions. So many thousands of things that we do daily activities, sitting, standing, walking, talking, eating, running, driving, these are all brain functions, well coordinated functions of all the parts that I just told you. So coming to neurological diseases, first of all, whenever you are suspecting a neurological disease, whenever your patient comes to you with a possibility of suspected neurological symptom, so you should know whether, first you should ask 3 questions to yourself. One is there a CNS disease in this patient? Yes or no, you answer yourself. Sometimes it may be very difficult for you to get the answer. Patient may come with some symptom which may look like a CNS neurological symptom, but in fact it may. That will come to that part little later. So, is there a CNS lesion? Then what is the then where is the lesion? Where? This where question where is very important, and entire neurological examination practice, the neurological life revolves around this where. This is called localization. Localization of the lesion is very important in neurology. Unless you localize, because each part of the brain has related to one different specified function. So depending on what function is deranged or lost, you can pinpoint say that without touching the place, so the lesion could be there. So there is a book on localization in neurological examination. There's a small book also. So what is there a lesion? Where is the lesion? Then third question is, what is the lesion? What is the lesion? Is it a tumor? Is it a bleed? Is it an insult? Is it an infection? So these 3 questions, if you ask, you'll get the answer. You'll get your proper diagnosis. So that is, in nutshell, what is all neurology about. Making in a simple words. Actually, the introduction itself is a 20-30 page topic actually. And so as I was telling, the history is extremely important in neurological exams. many patients, many times you can diagnose basing on only just historical points. That's why many times we just don't give much importance, much time to spend on history. So history is very important many times. For example, I leave it to you. You type the answers. One question for you. What are the diseases that you can, in neurological diseases, that you can diagnose based on history alone, without examining, without taking the help of any investigation? Open for you. What diseases, what can you diagnose based on history alone? Parkinsonism, yes, very good. Stroke, yes. Meningitis is not a correct answer. Meningitis, basing on history, you cannot, you can suspect, but you cannot diagnose. Huh? Cerebral palsy, yes. Epilepsy, yes. Good. Migraine. Bell's palsy also right answer. Migraine, there is no test. You don't do any investigation. Whatever you do, it will be normal. So migraine is based only on the history. Basing on the history alone. Migraine. Alzheimer's, yes and no. Okay. So these are the diseases you can more or less write when you say all these names of the diseases. So history, and history. You should never, if you want to become a neurologist tomorrow, you should try to become a historian first, because we have to take proper, as I always tell, we Indians are bad historians. So most of the Indian history books are written by foreigners, Chinese and Russian. Anyway, history is very important in our, nowadays we are forgetting, when somebody comes with headache, we are just writing the CT scan or MRI directly without knowing what exactly is the cause of headache. It could be a simple tension headache.
Why do we localize regions? Anyhow, we have to thrombolyze. Why should we localize?
That is very good but innocent question. Very good and innocent question. I am not talking about stroke alone. Localization is general. It could be tumor also. He is thinking that all localization only in stroke patients. No. All neurological diseases you have to localize. Which part of the brain? Is it meningeal disease? Is it cortical disease? Is it a brain stem disease? Is it cerebellar disease? Is it spinal cord disease? Or a peripheral nerve disease? So many components are there. See, localization means this. We, of course, as you rightly said, in stroke also we have to localize. We have to localize, and if at certain points, suppose there is a brainstem lesion, even a small brainstem itself is a small structure. If there is a small infarct, and if you thrombolize, if it bleeds, one of the complications of thrombolysis is bleeding. If it becomes hemorrhagic, the infarct, the ischemic area becomes hemorrhagic, then you will have a problem because it's a brainstem. So the same thing, if there is a small infarct in the cerebrum and if it bleeds, it's not as bad as it bleeds in the brainstem. Therefore, localizing even in stroke is very important. So that you will know only when you understand the anatomy and the physiology. What part of the brain will have what function here? Suppose I am lifting this chopstick, I am lifting this pointer. That means my fingers, my cerebellum, my motor function, my sensory, everything. If my senses is not there, I don't know that I am feeling this. It may fall down. And want to have a grip, I have to have my motor muscle power, and I have to have the coordination of the finger movements to hold this way by the cerebellum. So many things are working at the same time. That's why I'm able to hold the stick here. So that is a wonderful system that God has given. This is ultra super duper computer. We can't make an artificial brain for another 10,000, 20,000 years.